Hi everyone. Welcome to our overview of the Youth Wellness Hubs Ontario model. Today we'll be talking about principles and services. I'm Dr. Joanna Henderson. I'm a psychologist and senior scientist at the Centre for Addiction and Mental Health and Executive Director of Youth Wellness Hubs Ontario. The learning objectives for today are as follows: to describe the YWHO purpose, vision, values, overarching framework, and core services, to identify which YWHO components are already in place at your site and which are still missing, and to identify ways to work collaboratively with partners to build on your existing frameworks. First, let's discuss the rationale. Youth mental health in Ontario has not met the standards we would like it to meet for the past many years. Here are the facts. Research shows that mental health and substance use disorders impact 1 in 5 Canadian youth. In fact, about 90% of all adolescent health problems are due to mental health concerns and mental health disorders. In 2016, average wait times for some youth mental health services in Ontario typically exceeded 6 months, putting youth at significant risk while they wait for treatment. So what are the challenges in the youth mental health and addiction systems that get in the way of achieving the outcomes we all want for young people in Ontario? Well, poor access to appropriate services is a big contributor to our underachievement. Approximately 33,400 Ontario high school students have attempted suicide in the past year. 13.6% of Ontario high school students have had thoughts of suicide. Almost 300,000 young people attending high school in Ontario report unmet mental health needs. We have lots of fragmentation in our system. We hear often from young people, family members, service providers about poor interagency communication. We also hear about poor coordination and transitions between services within organizations and amongst organizations. And we hear about the system's failure to attend to the holistic needs of young people, not just thinking about mental health or substance use, but thinking about mental health and substance use in the context of the whole person. Lastly, we have separate service locations, separate service entry systems. We have a very disjointed system, and really some would argue we can't really refer to it as a system of care, but in fact, very disjointed sets of services that young people can access, but can't access in a coordinated way. We also focus on the costly kind of specialist model of care. Our system lacks alignment across its various components. Our use of costly healthcare resources is inefficient. We have young people who may not need to see a specialist in line waiting for a specialist. And we have other young people who probably do need to see a specialist who are not able to access those services. We have high rates of appointment no-shows. We have attendance to treatment groups often decreases over time. We really struggle to engage folks in services that could be helpful. And it's our responsibility as a system to figure that out. And the piece that's particularly important about young people leaving service prior to the end of a particular service component is the potential that outcomes won't be achieved. The positive outcomes that we hope will be achieved by engaging in a particular treatment may not be achieved if young people have ended the service early. We also have heard from youth and families and service providers about our lack of, as I said before, lack of system of care, and in particular the lack of an identifiable front door. Right now, if you were to drop a young person into any random community across the province and ask them to find the services that will be helpful to them if they're feeling distressed or overwhelmed or like they can't cope, those are very difficult services to identify in a community. Hospital-based services are more readily identified, but other services can be quite invisible. If you are able to perhaps identify some potential services that might be useful to you, it is then sometimes hard to actually find them, physically find them in a community. They're sometimes hidden away in locations that are not easily accessible on public transit. They're sometimes located outside of areas that are popular amongst young people. And so our system really struggles with this issue of being able to identify and locate the appropriate services. We also have duplication of service, and we have different organizations attempting to meet very similar goals, but in completely different ways, and without a real strategy for how to work together to align and to complement each other's efforts. And on top of all of the kinds of concerns that we've already talked about, we have a real challenge around data quality. So we know, for example, that young people will achieve better outcomes, more positive outcomes, they're more likely to achieve their goals when we use what's called measurement-based care. That means basically that we take a snapshot of how a young person is doing when they approach us for service so that we can understand their needs and understand where they're at. And then we do that over time once we've identified what are the goals we're trying to achieve and what are the evidence-based strategies that we're going to use to achieve those goals. As we work towards achieving those goals, taking that snapshot again over time allows us to see the kind of progress we're making towards those goals. Currently in the province of Ontario, it's really hard to get organized around some of those measurement-based care pieces. The quality of the data we do have available is really hard to understand, and in some cases it's clearly poor data. And so we don't have what we need to be able to understand the needs of youth in Ontario, nor do we have a system in place to use data to improve the quality of care that young people receive. Why do youth need services delivered through unique platforms? This is a really important question for our initiative in particular. When we look at how young people engage with mental health, addiction systems, and other helping systems, we can see that when they're young children, parents play a really important facilitative role in helping young people get connected up to service and following through with services that may be offered. Once people are adults and firmly embarking on their own autonomous lives, they are usually accessing services completely on their own. In between this stage, we have a phase of development where young people are often moving around to different communities. They're closely connected with family, but not so closely connected with family that family are continuing to provide the kinds of supports they did when they were kids. Young people are often thinking about their health and wellness and relationships across multiple domains in their lives. So when they're thinking in terms of their school performance or their what they're doing for work, and how their stress level is and how they're feeling emotionally. They may not be thinking in terms of mental health per se, but they're thinking in terms of the quality of their progress through development and achieving the developmental milestones that are typically achieved during the transition through adolescence and during the transition from adolescence into young adulthood. And when we look at the existing systems that we have for meeting young people's needs during this really transitional time in development, we can fairly clearly see that they're not designed, they're not purpose-built. They haven't been designed with that developmental lens in mind. They're very clinical. They're organized in such a way that the youth is not at the center of the development of our service delivery platforms. And so with Youth Wellness Hubs Ontario, we've really focused on developing a unique platform of service delivery that brings together all the core services in our system in such a way that it reflects what we know from the research about the needs of young people as they move through this transitional developmental stage. We have a number of foundational pillars that are the groundwork of the YWHO approach. First, we have a set of core services that are expected to be part of any YWHO service delivery platform. We are focused on developing an evidence-based funding methodology. We are aiming to create centralized access to mental health and addiction services. We are committed to measuring quality and performance. We are focused on improving data infrastructure. And we are very focused on supporting communities in engaging with continuous quality improvement. What I mean by that is really supporting service providers in being reflective about their own work, supporting young people in monitoring their own progress and engaging in meaningful conversations with service providers about the achievement of their goals and the services they're providing. It means supporting organizational decision makers to reflect on the data that they have about their own YWHO location and how it's meeting the needs of youth in their communities. And then as a system, as a network of YWHO sites, working together to constantly ask ourselves, whose needs are we meeting well, whose needs are we not meeting well, and what do we need to do differently to achieve better outcomes for youth in the province. So what do we need as part of our system? What do we know about what works? Well, we're really fortunate to be coming at this work with a background of lots of other people, both within Canada and outside of Canada, who have worked for many years in the development of very similar models. Headspace, for example, has spent over a decade thinking about youth mental health system transformation and building new models of care that are purpose-built to meet the needs of youth with mental health concerns. Similarly, Jigsaw is a national initiative in Ireland that has also been in operation for many years. Access Open Minds is a pan-Canadian initiative with 14 sites across Canada. Foundry is a province-specific initiative in British Columbia. Youth Can Impact is a research project, a randomized control trial here in Ontario with 3 sites in Toronto, where we're doing a very rigorous evaluation of the integrated model of service delivery for youth. When we think about and have done all of the planning that has informed YWHO, it's really been critical for us to understand from youth, from family members, service providers, and system leaders, as well as the research, of course, and the evidence accumulated from those other initiatives, as well as the broader evidence, to really think about what are the service components that are essential to address the system gaps we've been discussing. Early intervention services have been flagged both by youth and families, as well as by service and system leaders, as well as by, from the perspective of research and evidence that comes from the sort of science lens. Everything points to the value of intervening early. As young people start to experience difficulties that interfere with their ability to carry out their day-to-day lives, they benefit from services that intervene early. As I've already discussed, the value of both the model being developmentally appropriate, focusing on and understanding the need to meet the needs of transition-age youth as they move from adolescence into young adulthood, and they encounter all of the transitional challenges that come along with that, and that our service system really needs to focus on meeting those needs. It needs to be purpose-built for addressing those needs. We also know that a one-stop shop model of care where young people can walk in and be engaged in service, it needs to be stigma-free, no or low barrier, it needs to be conveniently located with hours of operation that map on to when young people need and want services, so including evenings and weekends in our service delivery model, delivered in a one-stop shop model where it's not just a single form of services, but it's really when we think across the community, what are all of the services that young people can benefit from in achieving their best level of wellness and engagement with education and employment and the other kinds of tasks that are in front of young people at that developmental stage. We know that the model that we've been using has not met the needs of young people. This old model, this old way of working where you reach out for service and then there are multiple steps and then you go on a wait list and you wait on a waiting list and then you go in and you have an assessment and maybe another assessment and there's no intervention and then you get on a waiting list for treatment, that old way of working doesn't adequately meet the need of young people. And so with YWHO, the focus is on walk-in models of service delivery where young people can, when they identify that they have a need and that they want to talk to someone, that they're able to access those services in a timely fashion. The focus right from the very first session is on intervention and de-emphasizes assessment. It focuses on thinking about solutions to the pressing problems a young person is experiencing on the day they walk in, as well as spending some time where young people are interested and it's appropriate to understand the bigger picture and understand the bigger needs. But the focus first and foremost is on being where the young person is at in the moment, providing timely service, and ensuring intervention is part of every session. It's really important that we think we are in a context where resources are not endless. We do, in fact, have to be able to operate in the context of the resources we have. And so we need to think about how to use those resources in a way that optimizes outcomes, optimizes the services and the outcomes that young people can achieve through our service system. And so it's really thinking about how do we ensure that the services we're offering are matched to the needs of the young people we're serving. And so part of YWHO is really thinking about and implementing a stepped care model of service delivery where the level of service intensity is matched to the level of need. And lastly, as I mentioned before, standardization, so that young people would be able to go anywhere in the province of Ontario and have an expectation of the kind and quality of service that they would receive if they are to reach out, and that the outcomes associated with that service are monitored over time, that young people can engage in services with a real focus on what are their goals, what are the outcomes that they're trying to achieve, and monitoring their progress towards those goals over time. With YWHO, we are driven by a sense of purpose. Our purpose focuses on improving access and service standards for young people through integrated youth mental health and substance use services. We are guided by a vision. We see YWHO as a critical step towards improving Ontario's mental health and addiction services for youth and young adults by integrating mental health, substance use, primary care, vocational, housing, and other support services into a one-stop shop model of care offered in youth-friendly spaces across the province. Thank you very much for joining me today. On your screen here you have our website as well as our email if you would like to reach out for more information. That's the best way to do so. Thank you.